to all. Today we are going to discuss about corpulmonale. Corpulmonale is a disease of the right ventricle characterized by hypertrophy and dilation that results from diseases directly affecting the lung parenchyma or lung vasculature. Definition of corpulmonale: it is the enlargement of the right ventricle secondary to diseases of the lung, thorax, or pulmonary circulation. So next we can see the etiology of corpulmonale. So three most common etiology of corpulmonale are diseases of lung parenchyma, diseases of pulmonary vasculature, disorders of alveolar hypoxia. We can see them one by one. Diseases of lung parenchyma. Most important etiology caused due to diseases of lung parenchyma are COPD, it is chronic obstructive pulmonary disease, cystic fibrosis, idiopathic interstitial pneumonitis may be due to idiopathic pulmonary fibrosis or non-specific interstitial pneumonitis, then sarcoidosis, bronchitis, bronchiolitis obliterans, pulmonary Langerhans cell histiocytosis. And then next we can see the causes happen due to disorders of chronic hypoxia, may be due to alveolar hypoventilation syndrome, obesity hypoventilation syndrome, neuromuscular respiratory failure, chest wall disorders like hyphosis, persons living at high altitude, hyperventilation syndrome including OSA, central sleep apnea, obesity hypoventilation syndrome. Next we can see the causes occur due to diseases of pulmonary vasculature, pulmonary arterial hypertension, idiopathic pulmonary arterial hypertension, veno-occlusive diseases, chronic thromboembolic pulmonary hypertension, pulmonary tumor thrombotic microangiography. So these are the causes that may happen due to this particular three major diseases. Next we can see the pathophysiology. The opposite causes like lung diseases and other causes inflammation, fibrosis and hypoxia. So this inflammatory changes and fibrotic changes may lead to increased arterial stiffness within the lungs, endothelial dysfunction and vascular remodeling within the lung parenchyma. It causes persistent pulmonary arterial hypertension, right ventricular hypertrophy, right ventricular failure, and finally corpulmonale occurs. Next we can see the most important types of corpulmonale. The most types of corpulmonale are acute as well as chronic corpulmonale. Clinical manifestations of corpulmonale are dyspnea, chronic productive cough, wheezing, retrosternal or substernal pain, fatigue, polycythemia. Then if the heart failure accompanies corpulmonale, additional manifestations used to occur. So they are peripheral edema, weight gain, distended neck veins, full bounding pulse and enlarged liver. Other manifestations are palpitation, atypical chest pain, swelling of the lower extremities, dizziness and even syncope occur. Next we can see the diagnostic measures. So in order to find out the particular condition, we want to collect the history of the particular patient, do the physical examination, head to toe examination. Then other diagnostic measures are electrocardiography, echocardiography, then pulmonary function test, chest radiography, lung biopsy can be done in order to identify the disease condition. Next we can see the medical management. So based on the particular condition, we need to support the patient. So provide oxygen to the particular patient. Then other drugs are diuretics, anticoagulants, vasodilators, anticoagulants, calcium channel blockers, endothelial receptor antagonists, bronchodilators, antibiotics and expectorants can be administered to the particular patient. Surgical management, phlebotomy is the most preferable surgery done to the patient with this particular condition. So that's all about